Good afternoon, listeners. Welcome to our podcast today. I'm very excited to introduce our guest today, who is Dr. Sharon Hausman-Cohen. And I met her after she lectured, and I was fascinated by one of her lectures. And I mean, the whole approach to individualizing medical care based on genomics, I think, is fantastic. And her firm, Intellex DNA, is one of the leaders in this area. So Dr. Sharon Hausman-Cohen is co-founder. She's the chief science officer and medical director at Intellex DNA. She speaks at many different conferences. She went to Harvard Medical School went to Harvard, I guess, both for undergrad and for medical school. And she's board certified in family medicine. So without further ado, I'd like to turn it over to Sharon and let her educate all of us on how she uses genomics and how it will help you help your patients, because it's individualized medicine.
Thank you so much for having me. So you and I have talked a lot about genomics in different fields, and I thought the best way to give the listeners an idea of how genomics can help them increase their precision, which means getting faster outcomes in their practice, is we'll use some different case examples. We can talk about anxiety, we can talk about cognition, we can talk about those mystery cases in women's health, and just kind of highlight how we untangle things. So
I think that's a great approach. I mean, I know that practitioners want to learn how it's actually used in person with patients. So this is a great way to do it.
So I thought we would start with anxiety. I think that you don't have to be a psychiatrist to have patients that want your help with anxiety. And in fact, if you're not a psychiatrist, they even more want your help, because as a primary care doctor, you're able to help people realize that feeling stressed or anxious, that is not a disease. It's a manifestation of how some of your genes interact with your lifestyle. And the reason I like talking about anxiety is in medicine, sometimes we get too algorithm driven. And when it comes to anxiety and depression, the medical field is absolutely kind of stuck on this. If you go to a psychiatrist or even many primary care doctors, they're looking to label you and then go, oh, okay, you have anxiety, you have depression. Therefore, first line is SSRI, second line is this, third line is that. And most of your listeners are probably interested in integrative and functional medicine. And that's the wrong approach, in my opinion, because we want to look at the root cause of disease. And the reason I'm taking anxiety as an example is there's a big mismatch between what is being used from a prescription medicine standpoint and what the common genes are. So even if we take the most common gene with the highest odds ratio for anxiety, which is what I call a thermostat SNP. It's called HTR1A. It does, HTR is like serotonin, so it does relate to serotonin, but it is a serotonin sensor. So if your thermostat in your house was set at 70, but the sensor was broken and it was reading 40, you're going to be cold because the heat's not going to go on. Well, that is the most common gene. There's a variant in that gives 2.7 times the risk of anxiety and depression. And if you just give someone an SSRI, first line for anxiety, there is really less than about a 40% chance that it's going to help alone, because you're trying to recycle something you don't have. But then there's a whole nother group of genes that contribute to anxiety. And so if you look at when we have Intellex DNA, we map out pathways. So with anxiety, how you process norepinephrine and adrenaline and dopamine, so the COMT gene can be important. How you bind your adrenaline, an adrenergic receptor can be important. How much orexin, which is a wakefulness hormone you can make, can be important. And there are really, if you look at 10 or 12 different genes that can affect anxiety, you're going to get better outcomes. And I'm going to give a short little example, if that's okay with you, Dennis.
Absolutely.
So there's a young woman, young meaning in her 20s, that came to me named Trina, not really her name, but we'll call her Trina. And her main complaint was anxiety, but she didn't call it that. She goes, I can feel stress in my body. I can be completely fine some of the time, but then if I'm worried about something, if I have a fight with a family member or a friend, or I don't do well at my workplace, or I just get upset about something, I get this like fight or flight response, and I just feel like I want to run, and I can sometimes even get kind of panicky or this hyper alertness. And she also had a young child, and said, I also find myself just kind of ruminating and worrying about my child. And so she doesn't have a problem with HTR1A. So we used precision medicine from the start. Had we given her serotonin medicines, first of all, it wouldn't have worked with what she wanted, because she wanted a natural approach, but it wouldn't have helped her. So we looked at her genomics, and they were really interesting, because she had COMT, which is very well known. It makes it so it takes 4 times longer to break down your norepinephrine, your adrenaline, one of the adrenaline pathways. So we talked to her about, when you get that stress release, it's going to last longer, because you release adrenaline under stress, and it's going to just kind of hang there. And that can be good from being a high achiever, but it's not great from an anxiety standpoint. But then she also bound her adrenaline more tightly, and that's not so great if you already make more adrenaline. But then she also had a thyroid-related SNP that made her not convert T4 to T3 well in the brain. That gives a 50% increase in anxiety. She also was low on making BDNF. So 4% of the population don't make enough BDNF. Why does that matter from an anxiety and depression standpoint? Well, BDNF hooks up neurons, and they've shown that SSRIs don't work well in people with low BDNF, because one of the things you have to do to recover from depression, and to a lesser extent anxiety, is you have to be able to hook up those neurons. And that's why they used to say, oh gosh, if you have depression, you're going to be on antidepressants forever. Well, not if you get their BDNF up, not if you address the root causes. And so this was really fascinating to her, and it made her feel so much in control of things, because now we understood that adrenaline piece for the episodic anxiety, and the need to get her BDNF up, because it indirectly relates to serotonin. She also had a lot of gut symptoms. The adrenaline gene variant that she had was associated with twice the risk of what they call functional dyspepsia. When she was a kid, she actually was in the hospital for these undiagnosed stomach pains. Now we had an answer to that. When you make too much adrenaline and you can't turn that off, you shut off your gut. So what can we do for that? Well, there's a lot of different things that we did for her, but some of the things that you can do is you can downregulate the cortisol production with things like ashwagandha. You can help to calm the brain with things like B6 and magnesium. But for her, we also added thyroid hormone. We also talked about the importance of exercise. We talked about exercise is the best option for BDNF. And again, 4% of the population, the same 4% that can't make enough BDNF, it affects cognition. It gives them almost the same risk for having cognitive decline in their 60s and 70s as ApoE4. And people don't realize that.
Does it matter what type of exercise? Are we talking about aerobic? Are we talking about any type of exercise?
Aerobic. And
okay.
So absolutely. And so for her, we were able to talk about the importance of aerobic exercise. She was able to rearrange her schedule so she could have a little bit of flexible schedule at work, so she could get to the gym a couple days a week. And then we said, if you can't exercise, there are supplements like BDNF Essentials that have the components in them, green coffee bean extract, different other components. You can probably tell us all the things in BDNF Essentials, because I don't have it in front of me, but it's a whole bunch of things that have, I know that curcumin has evidence for BDNF, and
we have lion's mane in there, which is a great anti-inflammatory. We have quite a few ingredients in that product.
And so kind of talking about, well, how do we keep your BDNF up? And I'm a big fan of exercise. So that, is the first line. but again, an ashwagandha to keep the cortisol down. I've had other people that their issue is that serotonin sensor, but instead of giving them SSRIs as first line, I'm going to give them things that help them make more serotonin. For example, in your anxieties, you have very specific probiotics in there. You have Lactobacilli helvetica and bifidolongum, because those are the ones that can help make more serotonin. So and actually magnesium also works for TNF alpha, which also contributes to anxiety and stress. And so being able to understand root causes allows you to be much more specific in your choice of how you address it. For one person, you may be pushing serotonin synthesis. For another person, you may be increasing their GABA receptors and increasing their GABA, again, depending on the etiology. And for another person, you may be giving thyroid hormone because of DIO2. So, and the great thing is we are having great success in anxiety and depression with using genomics. And we even have a focused report that's just a less expensive short form report, spotlight on anxiety and depression, that can help people much more, in my opinion, than pharmacogenomics, because it helps find the underlying root causes.
Well, that's fascinating. It's probably a good time of year to be bringing this up about anxiety anyway, right? With the holidays coming and how a lot of people react, from a stress standpoint.
Absolutely. And again, a lot of these things like anxieties, BDNF essentials, you don't have to take them every single day. If you can do things naturally some days with the increased exercise and meditation, great. But if you're having a stressful day, you can use them kind of as needed. And again, knowing, is my anxiety basically because of adrenaline? Is it basically because of serotonin? Is it basically because of GABA? Is it because of the BDNF and the thyroid? Can help you be more specific.
And what's also interesting, I think, is the research being done on the probiotics that you mentioned that we have in the anxieties, the whole bidirectional, between the gut and the brain. We used to think it only went in one direction. We now know it goes in both directions. And the idea that you can have published research on probiotics to help with stress, to help with anxiety, and I think one of the research studies also was on depression with these two probiotics, and it's very interesting.
Absolutely. I have a patient who right now, that's the main thing we're working on, is fixing her gut, because she had so many antibiotics. It completely, when I did a stool, a GIFX, she has so little, like undetectable bifidolongum, undetectable Lactobacilli helveticus, and her gut microbiome is so messed up that we're not going to get her under full control until we fix that.
Right. Well, good. I mean, it's a comprehensive approach that you're using here, which is fantastic. But yeah, go ahead with some more of your case studies.
So I was kind of going in order of age. So Trina was a young woman. I wanted to talk about a woman now who is in her 40s, and we're going to call her Lisa. And Lisa came to me after over a year of working with a different doctor for recurrent urinary tract infections and brain fog. And it got worse. She didn't really have this as an issue till COVID. And that's kind of a clue for any of you guys who know much about COVID. We'll dissect that a bit later. But these were bad enough that she had not been able to have intercourse for a year. And to not be able to be intimate for a year was a big deal for her, as it would be for many people. She was on antibiotics every single month for 8 months. And then, of course, she got yeast infections. And so she was like, this is this constant cycle. And why can we not get rid of the urinary tract infections? So Intellix DNA does not have a urinary tract infection pathway, but they have lots of pathways that relate to brain optimization, both ischemic, brain ischemia like strokes, as well as things that more classic relating to cognition like Alzheimer's and white matter changes. They've got tons of different things relating to hormones and relating to nutrients and such. And just foundations, inflammation, detox. So we did her what we call executive panel. It's kind of all the medical stuff and all the brain stuff. Stuff is a very highly technical medical word. We were able to get some clues as to what might be going on with both her brain that also related to her recurrent infections. So Lisa had two different SNPs that were really important. One was a mannose binding lectin related SNP. And for those of you guys who have heard of lectins, lectins are not about not tolerating tomatoes. Lectins are about fighting infections. And so the mannose binding lectin pathway binds foreign invaders or marks foreign invaders for your immune system to then come in and get rid of them. So it kind of activates the complement pathway. I describe it as the paintball pathway because it's kind of like marking it like a paintball gun would say, here, you got to get rid of this virus, this bacteria, this yeast. And the thing about it, and I see you laughing, is, and it really is pretty funny because it's so important and so under recognized, but it's 12% of the population that have one copy of an MBL2 variant that affects the immune system. And then there are people that have two copies, 1 to 4%, depending on which copy, that it really affects their immune system. And all of a sudden, they can't fight yeast away. They can't fight bacteria away. They can't fight Lyme because it affects spirochetes. They can't fight viruses. So one, she got sicker with COVID. She gets sicker with UTIs. She gets sicker with yeast. But then there was another pathway. She had a gene variant that is associated with higher fibrinogen production. It was in the factor V pathway. Wasn't factor V Leiden, but it was a different factor V and something relating to thrombomodulin. You don't need to remember the name of those genes. If you're going to use genomics in your practice, we have a tool right next to the name of the gene variant. It's going to talk about how does this gene variant work and what you can do about it, which is, of course, important. But that made me think biofilms. You know, if you have the propensity towards higher fibrinogen, and COVID makes your fibrinogen go up already, but then you have natural propensity towards it, and you have a propensity towards inability to fight infections, maybe this is a biofilm problem. And so for her, she actually had two copies of that MBL2, which is only 4% of the population. So I was like, I really think this is a big problem. So we didn't have to do this big fancy protocol. All we had to do is say, what can we use as kind of a protease antifibrinolytic to digest that biofilm? And then what can we do to boost her natural immune system? Because I didn't want to start giving her more antibiotics. And many of you guys will have heard of serrapeptidase. And serrapeptidase is an excellent biofilm buster for bladder. So lumbrokinase I use more when it's a brain issue, like a high risk of stroke. Serrapeptidase I like better for bladder. But we used BioDisrupt because it not only has serrapeptidase in it, but it also has cranberry extract in it. Many UTIs are E. coli, and cranberry can help you to make it so that you get rid of E. coli. It's kind of a natural anti-E. coli agent. And then it has things like peppermint oil and rosemary, and those are all kind of natural anti-inflammatory, but antibacterial as well. And do they also help the biofilm, Dennis?
Yeah, I mean, the product has two published research studies on it now. And one was, we were looking at the mass, the size of the biofilm, and also the activity of the biofilms. And we looked at, I probably can't mention exactly what they are on here from a claim standpoint because we're not making claims. But go ahead.
Oh, I was say I saw that study, and I know that you got disruption of the biofilm for C. albicans, which was the candida, as well as staph in the study. I'm aware of that study, and decreased the persistent form of Lyme.
Right.
So that's the study you're talking about?
Yeah, we actually had two. It was interesting, you know, when you looked at the original ones that we were going after, the biofilms, and seeing what we could do on them, you would expect as you titrate up that you would have a greater effect, which happened with all of them except Borrelia. And we looked at the Borrelia biofilm, the first dose had a very significant impact, you know, just like the other ones did when you looked at metabolic activity and the mass of the biofilms. But with Borrelia, it didn't work that way. When we titrated up, it went the other way. And so we thought initially, well, something must have gotten contaminated in the lab. So we had the research group, run a whole nother one of these, and it takes quite a while to grow biofilms for Borrelia, unlike others. I mean, I think it's at least a 6-month process before you could even try treating them to see what you can do with them. And we repeated it, exact same result. So then the idea was, okay, maybe there's some cytokine activity that's getting involved. And so we did another study on that, and that couldn't explain all of it away. And finally, our researchers talked to Eva Sappi, who is well known for her biofilm work. And she said, well, what do we know about Borrelia? As soon as the immune system goes after it, it changes its shape, so it evades the immune system. So really, when you're talking about biofilms, which is what you're talking about with that, it's probably something that should be not used every day. It's something that should be dosed more sporadically to get the real benefit of it. But it was very interesting how it was different. But that's one of the fun things about doing the research is we learn so much about not what the final result is, but why something is happening. And I think that was one of the really more fun ones. It just took a couple of years to go through that, though.
And that's one of the things I love about Researched Nutritionals, to be honest. I come from a very academic background, and I want to still keep evidence-based medicine. One of my goals was when I went to my medical school reunion is for people not to go, oh, did Sharon go to the dark side because she's going to do integrative and functional medicine? But I got up and I did a talk at my reunion to my classmates about how integrative and functional medicine was the most academic thing I've ever done, because now I'm understanding mitochondria, I'm understanding root cause of disease, and it was really fun. And I love that about Research Nutritionals, that you help us as a medical community further that knowledge and understand how nutritional supplements work on a cellular level, on a level interacting with the environment, with interacting with inflammatory things. So I think that is just absolutely wonderful. So anyway, so I put her on that, and then I gave her transfer factor to kind of, because I didn't want, so the good thing about the biofilm buster is that has really good evidence for lowering the candida. I think that in the study it lowered 65% reduction of the candida part of the biofilm. The serrapeptidase kind of breaks apart the fibrinogen, and then we had more exposure to the bacteria trapped in there. So I gave her the transfer factor multi-immune. And the good news is she is a much happier woman. This was about a year ago, and
Good.
she's not on those things anymore. I also gave her some resveratrol because it upregulates mannose-binding lectin pathways and has some inflammatory things benefit as well. But within like literally weeks, she's like, oh my gosh, it's been 6 weeks and I had sex again. And I hope this doesn't make this R-rated that I said that word. But we're doctors.
I think we're okay.
And she's like, and I didn't get a urinary tract infection. And it basically, she now has her life back and she is so happy. And it was so easy because the genomics gave me that clue of, oh my goodness, this woman can't fight infections, so I've got to hit the infection harder, but she also makes more biofilms. So that was a very fun, easy case.
That's fantastic. Again, the idea of being able to personalize it and realize that one drug, one supplement, one mechanism of action is not going to work for everybody. It has to be, the body's so much more complicated than that.
Absolutely. And that's why I think that you and I both love root cause medicine, because the more we can understand about the patient, and I don't want to talk about autism today. Any of you who deal with autism, come and see me, come to our training. We do great with that. But like, we've had fantastic results with even complicated illness like autism, like people having chronic pain, because we can understand the root cause. But one of my other big areas of interest where I have a couple publications is cognition. So I'd love to do just a brief little mini case on cognition, because I think it highlights a very common but not well recognized amongst the general medical population issue that contributes to cognition.
Okay, please educate us, enlighten us.
Okay, so I'm going to choose Sandy, and Sandy is only in 56 when she comes to my practice. And the reason I'm choosing a 56-year-old, not an 86-year-old, is you can do these same things with somebody who's in their 70s or 80s, But if you don't start asking the people that are in their 50s and 60s, do they feel like they're noticing anything wrong with their memory? They may be afraid to tell you. And intervening early is absolutely the ideal. And so one of the things for Sandy, so Sandy was a 56-year-old engineer. She noticed that she was having problems with math. And so for all of you that out there listening that are even physicians, nurse practitioners, you still need to. So if you have cognitive decline and you're like, oh, I'm still fine, I'm able to practice as a doctor, but you're like, gosh, when I have putting in a number and I have to go from here to there, I can't remember 5 digits anymore. Get your genomics done now and learn how to deal and understand the root causes so you don't let it get worse. So I was really glad that she came in, and that was really her concern is I'm going to have to change jobs because I'm an engineer, and if I can't do numbers anymore, that's a problem. She knew she was an ApoE4, but she's only 56, and most ApoE4s don't start to have problems until they're in their 65 or later, and that's because ApoE4 is associated with LOAD, late onset Alzheimer's disease. So what was going on for Sandy, we tested her for early Alzheimer's for pathogenic genes. She doesn't have any of those because everyone goes, oh, maybe it's PSEN or APP1. It wasn't that. But for Sandy, it was not just about the ApoE4, it's what ApoE4 is in combination with. And that's, again, where Intellict's DNA can really help, because there are people who are ApoE4 that only have 1.7 times the risk of Alzheimer's. And then there are people with ApoE4 that have 6 times the risk of Alzheimer's with one copy, and all kinds of other combinations, because ApoE4 interacts with many, many dozens of genes. Actually, the substance, the protein ApoE4, interacts with 1,700 promoters. But there are known associations that can double or even triple the risk of cognitive decline that relate to TNF alpha, that relate to how your mitochondrial membranes work, that relate to your hormone receptors, and on and on and on. So ApoE4 individuals in general have higher TNF alpha. They have higher NF-kappa beta, so higher inflammation, and lower IL-10. But they also have lower BDNF. And so for Sandy, she had, in addition to her ApoE4, a gene that was in the promoter, so the on-off switch of her TNF alpha gene, that made her make 4 to 5 times more than average TNF alpha. So the first thing we had to do for her was bring down that TNF alpha. And there's lots of things that can do it. One of my favorites is lion's mane mushroom, Hericium erinaceus, milk thistle, curcumin, sulforaphane. They're all great for that. But then there was another gene that she had 2 copies of, and this was the big deal. It's a gene that affects the mitochondrial membrane, and then she had with it another gene that affects mitochondrial DNA and mitochondrial repair. So really what we were able to say to her is, look, we think the reason that, and it's not just our guess, that mitochondrial membrane gene, 1 copy of it gives 2.7 times the risk of Alzheimer's. 2 copies of it gives more than 4 times the risk of Alzheimer's. That's more important than her ApoE4. She only had 1 ApoE4. So but then even that gene that was the mitochondrial repair, it gives more than double the risk of Alzheimer's. So now and don't worry about the names, you guys, because again, we offer free training, happy to help you learn genomics if it's something you're interested about having a precision practice. But now we had a map, and we could say, okay, if we're only going to do 4 or 5 things for Sandy, what's most important? And the thing that was most helpful was addressing her mitochondria. So we used ATP 360. And the reason I chose that is because with mitochondrial membrane issues, which 75% of the time is co-inherited with ApoE4, so a lot of those ApoE4 people you've got, guys, have this as well, is that ATP 360 has the lipid cofactors needed to help repair those mitochondrial membranes. But it also has stuff for the inside for, acetyl L-carnitine and phosphatidylcholine's outside CoQ10, things that help both the inside and the outside of the mitochondria. I don't know if you want to add anything more about ATP 360.
Well, also since you were talking about TNF alpha, and the published research on that showed a 19% reduction in TNF alpha. So for that patient also, I believe you said that she was high in TNF alpha. That would help there as well.
I didn't know that. That's great to know because, yeah, I gave her lion's mane, but obviously the ATP 360 that we were giving her, and we started her on 3 capsules a day. I know that you told me more recently that if you're trying to kind of get someone to repair more quickly, you can start with like a boost dose of twice a day if you want to.
Yeah. You can. There's certainly different ways of doing that with it, but I mean, it hits a number of different things with it. And we also, it's people think it's strange for an energy product, but we got a significant improvement in sleep with people, and we think what we were doing is helping calm down the central nervous system with TNF alpha going down, and so that was helping people sleep better as well.
Yeah, I've been really surprised at some of the studies because some of my patients that have problems making CoQ10, which is again another gene that we can look at. We look at over 600 different gene variants with Intellig's DNA. But I've had people that were having insomnia and palpitations that the CoQ10 helped them sleep. So I think that sometimes we don't really kind of, we have unintended positive consequences when we address the root causes. And then the other thing that we gave her, the other thing was she also was more fatigued before she got the ATP 360. And so she was excited. And I know you have published data showing that ATP 360 improves fatigue. And so that's whenever I'm talking to my patients about ATP 360, nobody likes when I say, oh, it's 3 pills a day. But as soon as I pull up that study and I say, look, even in young people, because I think the average age in that study was like 47 or something, relatively young, and say even in a young person, within 2 weeks, there was significant improvement in fatigue. They're like, I'll take as many as you want. Where's the ATP 360? Because
what's interesting is, I mean, so much more is coming out now on the metabolic system, and everything that's impacted by it. And I was at a lecture a few weeks ago, and it was by the psychiatrist, Chris Palmer. It was a fantastic lecture, and talking really about how that is really the center. And if you look at it a bit differently, might be one of the core problems that are causing a lot of the mental issues that we look at. And so if you can deal with it, and as he was saying in there, the mitochondria is the center of all of that. So if the mitochondria is damaged and the membranes are damaged, as you were saying, you're not going to get the electron transport chain to work properly because it's located within the membranes. So putting, whether it's stabilized NADH or tocotrienols or any of these other things in, those will really help get the body to work the way the body should be working. But it's fascinating what you can do when you look at the science of why something is happening and then try to build a product based on that to help. And obviously the genomic research that you do and your precision medicine is the key to this.
And well, thank you. We enjoy doing the research and getting the outcomes. The other gene, I always kind of say, if you want the next version of ATP 360, make one that also has like 2.5 milligrams of folinic acid in it, because there's another gene that affects cognitive decline and gives over twice the risk of Alzheimer's, that it affects the mitochondrial purine and pyrimidine synthesis pathways. And because it's the 3 steps before MTHFR, it responds better to folinic than it does to methylfolate. But I also gave her a little bit of leucovorin and prescription folinic acid. And between addressing her, we also addressed a few other key genomic factors. So her final plan was the ATP 360, folinic acid, lion's mane, sulforaphane, extra curcumin, because she had so much inflammation. She had IL-1 alpha and IL-1 beta, exercise, a mildly ketogenic diet to start with. We later transitioned her to Mediterranean. And we did, she was going through menopause a little bit early, and we did an estrogen patch. And she really thought she was going to have to switch careers, but she got so much improvement that she was soon feeling sharp again. So she is still an engineer, and that was about 5 years ago.
That's fantastic.
It was right whenever ATP 360 was coming out, because at first we had ATP Fuel, which was 5 pills, and then we went to ATP 360.
Right, right. Well, and it's really interesting too, all the research that's coming out, and I think you're right when you're looking at cognition issues, because the research shows that even in the mid-20s is when we start seeing declines typically in people. And it may not be noticeable, but there, even some of the ways they're looking at it, like, puzzle, ability to do puzzles as quickly, for quite a large percentage of the population starts deteriorating in the mid to late 20s. And then there's other things in the 30s. I mean, it happens a lot earlier than we think.
And I think that's a really important point. I know that we start screening all our patients. We'll use CNS vitals when they're 50 because it's a computerized test. It's more granular than getting at just like a MoCA or a SLUMS. And we do sometimes see people, and we probably need to go earlier. Sometimes we'll do it in the 40s. But there are some things that are so basic. There are people, 18% of the population don't transport B12 well to their brain. That's such an easy fix. You just give them more B12. So I think it's a good point that we need to be looking for it. But the reason that we developed Intellig's DNA is people were coming to us with during the 23andMe revolution and saying, I got my genetics done, my genomics done. Can you use this to help me prevent Alzheimer's? Can you use this to help me prevent Parkinson's, macular degeneration, diabetes, heart disease, whatever was in their family? And there were no tools out there that really made genomics actionable. And so what we don't want to do is just tell people, oh gosh, you've got this gene, you're at higher risk. We want to help people understand what are modifiable root causes that can affect your health. And that's why we always look at a wide variety of types of inflammation. There's mast cell inflammation, and there's CCL2, which is more tissue destruction, and there's IL-1 beta and autoimmune, and they're all different genetically. But we look at all these foundational pieces, and we have genomics that we use it routinely in our practice. We're family medicine, and we have kids as young as 1 month old that we've done their genomics because mom and dad had some things that they want to prevent. And you just get healthier, happier human beings because you can help them know if you only need 3 or 4 things, if you were going to only do 3 or 4 things, diet, lifestyle, and supplements, what would be the most effective for you? Or if you have family history, something more severe, and you're starting to notice symptoms, diabetes, anxiety, depression, cognition, on and on and on, autism, what can we do to make a targeted plan and get you well? And that's where I think genomics can really help your practice.
So when a practitioner decides, hey, we want to work with Intellig's DNA, what is the approach? I mean, they obviously contact you, but what is the educational aspect of it for them?
That's a great question. So we realized, we're the genomics being used in Dr. Bredesen's cognition studies.
Interesting.
And we
I don't think I
realized
knew that. That's very interesting.
Yeah, Kat Toops and Anne Hathaway, and the study that was published in the Journal of Alzheimer's now a year and a half, almost 2 years ago, they used our genomics, but they are also using it in their current study, which is larger. But even when we took thought leaders in the country on the topic of cognition, we realized they didn't learn genomics in medical school. I didn't learn genomics in medical school. So we developed a really strong training program. So anyone who calls and they would go to our website, which, just so you know, it has 2 L's and 2 X's, INTELLXX DNA. It's for an intelligent approach to DNA, and the co-founder and I are both women, so the 2 X's. They schedule a tour. Yeah.
I didn't know that either.
Yeah, that's how we got our name.
I knew about Carol, but I didn't know about the 2 X's. Okay, I'm learning a lot
Carol
here.
is our co-founder. And we have a virtual training program that as soon as you order your first report, you get free access to it. We kind of affectionately call it Genomics University. You just don't get any university credit. You get a little seal for your website. But we also have a mentoring program, because one of the things that physicians have told us is, okay, we're getting all this information. How do you take this information and make it into a nice, neat little consult that's not going to make me crazy or the patient crazy? And we show them, we say, okay, map out what are the key inflammation things. And eventually they map it in their head. What are the key detox issues? What about key nutrients? and then pick one or two concerns. You're not going to say, oh, let me give you 40 different things for issues that are not their concerns. And what you'll find is by doing it that way, you're able to come up with whatever, depending on the severity of the patient's symptoms, here are the 3 or 4 supplements that are going to work well that you might want to start trying with. Here are a couple of food issues, because we don't just put in things that are supplements. We put in diet, lifestyle supplements, and medications for when appropriate. And we help you we even do mock consults with you on your mentoring sessions. They get to do one with me and then 2 with the members of my team about here's how you can do it. And with that training system, we've had great success. We also have a live conference, which is the best way to get completely fluent in genomics. Just come to our live conference in July. It'll be, just to put in a plug, the weekend of July 25th this year. And we do 16 different kinds of cases over the course of a weekend, and we also do some business discussions and kind of practical things about how to use this, and people get really fluent.
And I have to say, I've gone to 2 of those conferences now, and they're fantastic. And
Thank you.
they're so factual, but they're so applicable. And the idea that you can really help people in a very specific way, for that individual is incredible. And what I've noticed, I think the group that attended this current July's meeting was probably at least twice what it was, the year before. And so who knows, maybe this will be another, doubling or whatever. But it just shows you how interested practitioners are in this and what you can do to patients and improve their life.
Yes, we actually turned away people last year, so we did get a little bit bigger room this year because we
I think that's a good point.
So yes, if you're interested, we'll get you information. It's really fun, and I really appreciate the research that Researched Nutritionals puts in, so that they have products that people can use, so that when they're understanding the root cause, they can go, how does this fit in? But using genomics has been not just life-changing for me, but as I get the privilege of training physicians and other clinicians across the country, it's been so amazing. I had one naturopath this week that I was working with. It was her 3rd report. So, but she wanted to tell me about the 2nd case because her 2nd patient was 5 weeks out now, and she started to tear up because the 2nd patient was a child whose parents brought her this child because of learning differences. And this child, he was in 4th grade and could not read even one word yet. He was not even reading at a 1st grade level. He had severe problems with mitochondrial things. He had some mitochondrial things, but not the typical autism like folate receptor. But his main thing was that he had significant problems absorbing choline. And so she said, I just did a few starting things. There were some inflammatory things, but nothing crazy because it was a kid. And she said he came back at 5 weeks, and his mom said he's now reading at the 2nd grade level. To go from 0 to 2nd grade in 5 weeks, and then he came because of behavioral issues. And she said the behavioral issues were gone in 1 week. So know that we're not going to always improve your patient's symptoms in 1 month or 2 months, but I think that if you are interested in functional or integrative medicine or the root cause of heart disease or diabetes, or even with our patients with Lyme disease or co-infections, we're finding it really helpful. Not that it tells us how to treat the Lyme disease. You can go to iLads or study with Tom Moorcroft for that. But because then you understand, why does this person get the swollen knee and this person get the brain symptoms? And it helps you get rid of the symptoms that the Lyme disease causes while you're also treating the Lyme disease.
And you know what I think is probably also true, and we have found this, like when we were talking about the ATP 360 before, it's not just for people who have maybe specific issues, from health standpoint that, they really need help on, they have mitochondrial issues or whatever, but we have elite athletes using the product also, because a lot of the mechanisms that are a problem for patients who are having other issues impact elite athletes because of what they do to their bodies. I mean, if you look at these ultra marathoners, I mean, they're thrashing their bodies, they're creating so much oxidative stress, so many cytokines are going crazy that they need to work on repairing the mitochondrial membranes. They need to make sure their detox is working properly. So I think even from the standpoint of what Intellex DNA does, that I'll bet practitioners who are working with athletes who want to make sure they maintain, peak conditioning and all, probably could benefit by the work you guys do as well.
Absolutely. And another really important product that we've found beneficial from Researched Nutritionals is the Histoquel, because we've had people come to us where we thought it was ADHD, or we thought it was PANS, or PANDAS, which is the pediatric autoimmune neuropsychiatric symptoms, where they were getting these spikes of really kind of bizarre behavior for children, or outbursts, or adults with cognition symptoms where it really ended up being mast cell. And one of the things I really like is that one of the problems with some of the mast cell related SNPs is if you have combinations of IL-13 and IL-4, which by themselves don't cause that many problems, you'll start to switch in response even to infections. You'll switch your B cells to making IgE, and then you'll start activating your mast cells. And so Intellex helped me understand this little girl who, when she got sick or her brother got sick, she started acting like she had autism, even though the rest of the time she was fine. And, again, doing bizarre behaviors and hiding in a corner and not being willing to go to the bathroom on the toilet and all kinds of things, even though she was 8. But then once you start addressing the mast cell, once we saw the genomics, we knew that she was doing this kind of switch, and that when she was getting sick, she was creating an allergic reaction. She also would get weird behavior or the bizarre behavior if she played too much in the grass. So you can help. But the thing is that a lot of the supplements that address the histamine pathways are not addressing IL-13. And one of the strongest things for IL-13 is Perella, which is, I'll let you tell what Perella is, but it's a seed that has a bunch of other things in it. And that's the only product out there that I know of that has Perella.
Well, yeah, and I mean, there are a number of nutrients in there that I think are really helpful, but it's the combination of looking at two mechanisms. One is blocking as many of the histamines from being absorbed into the cells, but the other part of it is, can we reduce the amount of histamines being released from the cells? So there's two different mechanisms in that Histoquel product, and we're excited because that's currently under research at Northwestern University now. And so, I mean, these are the type of things that I think are fun. I feel like we're a kid in the candy store when we get to start new research projects. So.
Absolutely. And it's really important because, so from a genomic standpoint, you're right. If you can stabilize the mast cells, that's really important because, again, some people's symptoms are because they over-release IgE. Some people's symptoms because they bind the IgE too tightly. But there are people that if you give them steroids, there's a genomic variant, about 8% of the population. If you give them steroids, they release more IgE instead of less. And so being able to address the root cause and understand it just makes so much sense. And I was just working with a patient today that a teenager who is having horrible allergies on Zyrtec. And I'm like, okay, you have to stabilize your mast cells because of your genomics. Let's try the Histoquel. It's not going to make you sleepy because he's applying to college. So whatever age you are when you're applying to college, so maybe that's 17 or 18. Gosh, I'm getting old that I can't remember those days anymore.
Maybe that's intentional, right? I want to put it out of our,
yeah. I'm going backwards to what markers we see in grandchildren, not yet there. So anyway.
This is fantastic. It really is, Sharon. I mean, you're just so insightful in what you're doing, and I love how you're helping people and helping practitioners, do better with their patients as well.
Well, thank you. Thank you for having me. And anybody who is listening who wants to get trained, we are what's called a clinical decision support tool, which means that because we give so much information regarding mechanisms of action, but also interventions, we give diet, lifestyle, supplements, and medications, but we also give information on typical dosing and all of that. The FDA does restrict us a little bit regarding who we can sell to. So we can't sell to consumers, but we can help you find, if you're a consumer, find a practitioner that's trained. But we can sell to naturopaths, DOs, MDs, PAs, nurse practitioners. And so if you are a qualified healthcare professional and want to get trained, go to our Intellics website. There's also lots of fun videos there that you can watch for more information. But you can sign up for a free tour as a thank you for taking the time to give a free tour. They also give you a discount on your first couple of orders, which is nice, so that you can get some experience and you can get started with training. We have so many patients reaching out to us all the time that we're always excited and happy to train more practitioners across the country, whether you're taking care of kids or adults.
Well, that's wonderful. Again, Sharon, this has been helpful. I think there may be some questions that we have here too.
Sure.
Okay. So one of the folks is asking about the lactobacillus. Maybe this was that you were talking about. Maybe this was in anxieties, I'm thinking.
Mm-hmm. Yes. So one of the things I tell people, there's different antibiotics and there's different probiotics. So you can't just tell your patient, go get a probiotic. There are some probiotics that increase dopamine. If it was a high dopamine person, that might be bad. There's a case on our website that was an autism child that got worse with certain probiotics. There's some probiotics that help to increase gut motility. But particularly for serotonin, Lactobacilli helvetica and bifidolongum are well studied for increasing serotonin. And so that's why I was saying it's not like when they were making anxieties, they just thought, oh, let's throw some probiotics in there. I loved the fact that it was very thoughtful and matched with the literature regarding the known probiotics that increase serotonin, because the most common gene that contributes to anxiety and depression is not about serotonin recycling, but about not having enough serotonin to start with. So that works.
Right. Another question is, did you start with a ramp-up dosing of sulforaphane and then go back down, or when you've been working with sulforaphane, what have you done? So
when I use sulforaphane, I tend to use products that are studied in the literature. So the brand that I don't know the milligrams of the brand that I've been using is Avmacol, or the Avmacol Advanced, which is, I think it's like 30 some milligrams, but it goes by the milligrams per kilogram. I think of it is in their studies, and they have studies in autism, they have studies in schizophrenia. They used one pill of their regular per 30 pounds for the child, for 30 to 60 pounds. There's a window. So if there's someone that I have that has mold, so sulforaphane is great because it upregulates NRF2. It helps with NF-kappa beta, which again, those are a lot of letters, but it means it decreases inflammation and upregulates detox. So if there's somebody who really has problems in their brain, I go higher. So I give it with food because it's better absorbed. And if I had that like mold patient, I would tend to start with probably the stronger formulation twice a day, but maybe once a day for the first week. But I really haven't had problems with intolerance with it. If I have somebody where I'm just using it more for its anti-inflammatory, but they're not having kind of mold or needing as much detox, I might start at a little lower dose. And the biggest thing is taking it with food, and use a good brand that needs either moringa or morosinase in it to activate it.
Okay, great. Another question. How young is it safe to start supplementing with methylfolate in the double SNPs of MTHFR patient? And is it also safe in pregnancy?
So let me answer the pregnancy question first. There was a study using a prescription supplement that was, it has basically 2.5 of folinic acid, about 5 milligrams methylfolate, and then other B vitamins. It actually got FDA approval as a prenatal vitamin, ENL, or Enlite, and that they did a study that showed that they not only are safe in pregnancy, but they got 80% of women into remission just using that with depression during pregnancy. So I feel very comfortable. I always like to go, has this been studied? And so, yes, methylfolate, folinic acid, B vitamins have been studied during pregnancy. I always try to go with whatever doses have been studied during pregnancy. And I don't know, I don't know if you guys have a methylation product that has about that same dosing in it.
No, we
Yeah.
don't. No, we don't.
I think that that's one that you didn't do because there were a lot of other companies doing it. And sometimes
There's that,
makes
and the
sense.
other thing, we is the concerns with people with methylation issues, and do you want to have? I mean, as a separate standalone product, I think it's great because then you can really target it where it needs to be. As part of something else, which is what we originally had, it didn't work as well that way.
Yes, and then the question was in children. And so I'm going to say that what we always tell when we're training clinicians is there's not always recommendations of specific dosing for young children. So you need to use your clinical judgment. That's the whole reason we only sell to licensed healthcare professionals. But we know, for example, folinic acid, for example, has been used up to very high doses in children with autism and helps recover speech. Methylfolate, when I'm starting it on a young child, I will often start with a low dose, a product that has 1 milligram in it. But there are a number of products that are made for children that have a combination of methylfolate and the B vitamins, the B12, a little B6 in it. I do think that if you are starting methylfolate, you want to make sure that somebody has enough B vitamins. Sometimes if a child doesn't have enough B vitamins like B12 and you start methylfolate, it pushes that recycling pathway a different way and they can get hyper. So just be aware of it. And again, that's why we use genomics. Does this child need folinic acid? Do they need methylfolate? Do they need B6? Do they need B12? It's not much fun to draw blood on children. So if you can get a little bit of a starting idea based on their genomics to start to get them better, you're not going to need to draw blood right away. Now, if you're using long-term products that are like, if you're going to be using zinc for a long, long time, you may eventually need to draw blood. But it's nice to be able to have the genomics to kind of give you a roadmap as to what an individual might need, get them started. And then once they see that their child's getting better or that they're getting better, they're more willing to say, okay, well, let's do some monitoring if you feel like you need blood.
Wonderful. Well, we're out of time at this point, but again, Sharon, thank you so very much for this incredible discussion and the wonderful work that Intelix DNA does. So this has been an absolute pleasure.
Well, thank you for having me, Dennis. It's always a pleasure to talk with you.
All right. Have a great day.
Thanks.
All right. Bye-bye.